First off, I'd like to welcome you all to Kimmie's Recovery Zone. Thank you very much for coming here and supporting our first presentation. This is going to be the beginning of a series of live and recorded presentations that will be available on this site. We hope that in the future you'll visit the site often, that you will that we're going to try and develop a newsletter and an announcement of events that is going to be in the works. So hopefully we'll have captured information about how to stay in touch with you. But by the time the 6 weeks is over, you're going to see some amazing opportunities for us to be able to reach out and help provide services that support families, loved ones, and everyone finding a path of recovery. Not to mention a lot of other life activities that enhance the quality and spirituality of everyone's being. So with that, we're going to get started here. And like I said, I'd like to welcome you to our first presentation, which is Alcoholism, Addiction, in the Family. And we're going to do this for the next 6 Tuesday nights. It is going to be an evolving program. I will do my best not to bore anyone, as I am certainly one of those people that doesn't like to be bored either. This is, as said on the flyer, we have been, we're looking for people who have been impacted by the disease of addiction in their families, their households, their loved ones. They are having a difficult time understanding why their loved ones are having challenging times, and what can we do to support them? And sorry, I'm just trying to figure out how to do this. Okay, so there's no feedback. I hope that that's not going to happen. I got to turn that off. All right, so can't do it without feedback. People who don't understand how addiction is a disease, and that is most commonly demonstrated by when you asked a loved one, why can't you just stop, in some way, shape, or form? Or when someone says, you'd think that they have so much going for them. You'd think that they would cut down or control their drinking or their drug use, or they have it so good. Don't they see what's going on? And the other part is that on the other side is that how do you effectively support someone that you love that suffers from the disease? And the questions about the effect and impact of addiction. People who feel hopeless about the futures of their loved ones. There's a quote that says, addiction isn't a spectator sport. Eventually, everyone gets to play. Now, what's kind of funny about that, this particular quote was taken from a fiction novel about a woman who was an alcoholic who wound up in a treatment center. And, but this is, no truer words have been spoken than this has been, that has been told. So what we're going to be covering over the next 6 sessions, and tonight we're going to probably I'm going to try and get into touch over as many of these as I can to give a foundation, but then we're going to go into greater depth at different points with a lot of these topics. Tonight I'm definitely going to be focusing on the disease concept, chemical dependency, family systems, family roles. I'm going to touch on codependency and touch on signs and symptoms and touch on communication skills and sort of introduce pathways to healing. This is not any kind of a surprise ending. Many of these things are going to be reinforced in different ways over the next 6 weeks with a lot more specific topics as well. So I'd like to get started. Just want to double check. Does anybody have any kind of questions before we get started? I um, I also want to go over some of the questions and comments that I had asked previously of the, when you registered, and what people said. The reason why I asked these questions is because many times in a group dynamic, you're all going to, some people can verbalize what you're thinking or feeling, and, and sometimes you want answers, but you don't know how to formulate the questions. But seeing as how there's so many commonalities of what everybody goes through, that if I share some of these thoughts, that especially the ones that are consistent about having, I asked, why are you interested in this program? And people have talked about like how loved ones have abused alcohol in different ways, and they want to learn how to support them. They have a loved one who's an addict or an alcoholic. People in the recovery community who want to learn more about the disease. People who have lost loved ones to this disease, and that there are still some that are alive that they want to see stay survive. And to learn this on the other, about the other side, learn how to support people. And I like this one, while maintaining boundaries. And also to learn about the pathway of recovery. And I'm certainly going to get into a lot of those things as well. What do you hope to achieve from this program? A better understanding of what they're going through and how to better support them without getting frustrated or angry. One of the things about family programs is that you're going to learn a couple of valuable things about how you didn't cause it, you can't control it, and you can't cure it. And that how you learn to take care of yourself has a tremendous impact on the success of somebody else's recovery, much less your own. How you're going to be able to help someone. And when you have a better understanding of the disease concept, of what roles are and systems and that happen in the family dynamic during active addiction and active recovery, you'll find out much better ways to help them and help yourself. I'm certainly going to try and cover the best I can about family dynamics and addiction. This is a good one. Pick up a few more ideas on what to fix or change in my thoughts. And I understand that, then to understand that it's not your fault and that you could not or cannot help or hope to help others. And how, from also a standpoint of learning how my addiction, this is from somebody who's in recovery, affects their friends and family, because it's also kind of a good introspective look as well. And then greater clarity on how to manage your own reactions should your loved one relapse. And that's an important one. And supporting people and learning tools to avoid addiction, especially when it's in the family. And that comes from a loved one as well. Then the third question has, please list any questions you may have related to your purpose for coming to the program. How can I avoid being a trigger? How can I support them when they're drinking without coming off as preaching? And should I use ultimatums? Something I want to stress is that this is not an Al-Anon group. This is a psychoeducational presentation about the disease of addiction and family systems and family roles and family pathways to recovery. So I'm going to do my best on providing that. I'm not going to be getting into a 12-step facilitation or any kind of therapeutic modalities. That is something that we'll recommend later on about when we offer advice on finding counseling or finding groups that are really important on helping take you to another level. So Here's, we all talk about, we're going to get into talking about the disease concept and the definitions of dependency and the signs. And we also, we all refer to it as the elephant in the living room. Now, if you see our friend here who is holding the glass, he's obviously responding to his loved one commenting, I think, about his drinking, and he's saying, "What elephant?" And that is not an uncommon thing. Yeah, you're going to find as I show you more pictures of our elephant later on, and we'll get into that in a couple of slides. But let's talk about the history of the disease concept. In 1784, it was introduced as a disease. It was treated as one, but it wasn't officially recognized as a disease. In 1840, there was a group of people called the Washingtonians that formed out of Baltimore. They amassed over 600,000 members, but after a few years of infighting and factions and outward supports of different things, they lost their focus on the primary purpose. And one of the things that was their biggest downfall is that many of their members were starting to lean towards the abolition of slavery. And so they lost their focus on that. And in some comments, when Bill Wilson and Dr. Bob Smith started Alcoholics Anonymous in 1935, almost 100 years later, somebody brought up the questions about the Washingtonians. They said, "Who?" And nobody had ever heard of them because they were so quickly, they came and went so quickly. Now, here's an interesting thing. In 1879, Dr. Leslie Keeley opened up more than 120 Keeley Institutes. They used a method of medication and tonics that they would sell retail and have these facilities. They were franchised, private, for-profit addiction treatment institutes that finally went defunct in 1965, almost 200 years later. Almost 100 years later. And so it was very interesting that they had so many of these, they got up to 200 institutes by 1965, and then they just fell apart. 1901, Charles B. Town Hospital opened up for drug and alcohol addictions. It was on the Upper East Side on 68th in York, and became a new type of private drying out hospital. And one of the things that's most popular about that is where Bill Wilson had his spiritual experience. And when Bill went on a trip to Akron on a business deal and was about 5 or 6 months sober at the time, he was concerned about his own drinking. And that's when he went to the directory of the Mayflower Hotel and found the phone number for Reverend Tunxus, who connected him with a woman, Henrietta Seiberling, who had a friend whose husband, Dr. Bob Smith, was an alcoholic, and they were all part of an organization called the Oxford Groups. Now, the Oxford Groups were a religious organization that prayed about pretty much everything. And because of their connection to Alcoholics Anonymous, there are some that believe that the Oxford Groups was a temperance movement as well, and it was not. It was a religious organization that was very concerned about a lot of things. In 1948, there were 2 men in Minnesota that worked in the prison system, in a psychiatric hospital, that started what was called the Minnesota Model, which was adopted by a nonprofit organization known as Hazelden. And what they did was that this is the beginning of what the 28-day treatment program and the development of 12-step facilitation method of treatment began. And anybody who's in recovery, if you look at the Back to Basics book, when you're doing the 12 steps in 4 weeks, that's pretty much how the curriculum came from. In 1952, the American Medical Association first defined alcoholism as a disease, because it had signs and symptoms, and it had a pathology, it had a course of treatment, and that's all it needed to be classified as a disease. So now ACM stands for the uh, American Society for Addiction Medicine, and they were formed in the late 60s, early 70s, and they define addiction as the following. Addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Now, the thing is that this is how your brain gets wired. And this is why it's a brain chemistry disorder. Dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations, basically meaning dysfunction. And this is reflected in an individual pathologically pursuing reward and or relief by substance use or other behaviors. Meaning, when they say pathologically pursuing, is that they are just constantly looking for more. It is a chemical biological issue that is primary, progressive, chronic, and ultimately, if left untreated, fatal. It has biological, environmental, genetic, and neurological sources of origin. And it fits the traditional medical model of disease, which requires that only an abnormal condition be present in a person that causes discomfort, dysfunction, or distress to the affected individual. And if you look at our little elephant over there, there's some of the other things that are parts of that disease. Right up there in the top, and notice it's attached to the ear, is denial. You've got ignorance in the brain, diversion in the sight, silence in the mouth, reluctance in the heart, and avoidance and awkwardness in the body. And then there's the trunk. Okay, these are the characteristics of the disease concept. An inability to consistently abstain. We refer to that as the obsession and the compulsion to keep using. Impairment in behavioral control. It is said that alcohol, opiates, THC, benzodiazepines, stimulants like cocaine and other amphetamines, barbiturates, and several other things are called depressants, central nervous system depressants. Now, this doesn't mean that it's making somebody depressed. What it means, and if to use a metaphor, imagine, if you will, you're holding a sponge in your hand and you're holding it under a running faucet. And as you squeeze that sponge and let go of your hand, the sponge is doing its job, absorbing water, releasing water, absorbing water, releasing water. Now, your hand, being the central nervous system depressant of choice, as it squeezes that sponge completely and not letting go, the sponge is no longer able to do its job, and that water just runs right over the hand. Well, that's basically what's happening to the front part of your brain known as the cerebral cortex. And in the cerebral cortex, or the frontal lobes, is where your rational thoughts, rational emotions, executive functioning all happen. And when a drug that is a depressant drug is introduced to that, that brain part can't function. So everything gets kind of funneled down into the amygdala or the hypothalamus or the hippocampus, and that's where impulses and impulsive behavior and compulsive behavior take over without any thought. So that's the major impairment in behavioral control. So if you want, just to give yourself a little thought, because we're human, how many times have you made a decision based on an emotion? And what I'd like to ask is, how well did it turn out most of the time? And I bet be willing to admit most of you are going like, maybe not so good. So another thing is cravings, increased hunger for drugs or rewarding experiences. Get out of the feeling that you're in. And cravings aren't necessarily to be stereotyped as like somebody sitting there like, shaking and jittering like, oh, I gotta get a drug. Oh, I got a drug. Sometimes it's like, triggered by a thought of like, or a sight or a sound. It's a sensory thing that all of a sudden it's like, wow, you know, that wouldn't be such a bad idea right now. So cravings have lots of different uh, intensities and levels and things that happen that said, you know, that take over. And as you get farther on into the disease, it really, you know, those cravings do get to the point where it becomes an obsession. Diminished recognition of significant problems with one's behaviors and interpersonal relationships. Okay. Everything starts becoming what we call maladaptive behaviors. It becomes, in a way, like, well, what's the big deal type stuff? And, you know, or that, you know, well, you know, I did it before, I can do it again. Or, you know, finally, when somebody says, you got to stop doing this, you're like, but why? You know, so going back to why can't you just stop? And it's like, I'm not causing any problems. Dysfunctional emotional responses, not normal stuff. And I'm going to get into this in a little bit, because how you handle situations that, you know, crises, relationship issues, something that would take, you know, it just, you look at somebody who's an addict and their response is like, you know, don't you, you know, it just, you're just like, what are you doing? And addiction can cause disability or premature death, especially when left untreated or treated inadequately. That's treated inadequately is a big one as well. Some people try different strategies and methods to stop, and they don't work. And you can ask almost anybody how many different ways they tried to stop or cut down. So in the substance use disorders categories of what's called the Diagnostic and Statistics Manual, 5th edition, that's the DSM-5, that's pretty much a Bible for mental health and behavioral health persons in this field, where everything is defined in here. There are 11 different criteria that cover substance use disorders. Now, to follow into a diagnosis of becoming someone who is substance use dependent, and there is no clinical word for alcoholic or addict. We say somebody meets criteria for alcohol use disorder or opiate use disorder, or, you know, what we used to say dependence, but now it's disorder. So I'm going to run through some of these, and these are formed in questions and little pamphlets and things that taking the substance in larger amounts or for longer than you've meant to. How many times have you wanted to cut down or stop using, but not able to? Spending a lot of time getting, using, or recovering from the use of a substance. And this is part of the progression side of when somebody is going deeper and deeper into their active addiction. Cravings and urges to use the substance as they get, their intensity grows over time. And then not managing to do what you should at work, home, or school because of substance use. When you start losing your accountability and responsibility on more consistent basis. Continuing to use even when it causes problems in relationships. Now, primarily relationships with other people, but relationships with your job, relationships with the law, relationships with institutions. These are very big things. Giving up important social, occupational, or recreational activities because of use. Because you may be wanting to get, you know, that person may be wanting to get high, may be high already, or may be recovering from getting high. Using substances again and again, even when it puts you in danger. Now here I'm talking about risk of, you know, of harm. Drinking and driving is probably the most common one, but also by doing activities where you shouldn't be impaired is another one. And just other things where your thinking isn't correct either. Continuing to use even when you have a physical or psychological problem that could have been caused or made worse by the substance. Now, this is the medical side or the mental health side. If you are having any kind of organ issues, liver, kidney, heart, brain, lungs, anything, pancreas, and they're told by the doc, yeah, maybe you shouldn't be doing that. And I got some scary news that there's a lot of doctors out there that could use a little deeper education on this, because some of them say, well, why don't you stop for a couple of months? I've had clients that have had diagnoses that were dire, and 4 doctors, 3 of them say stop completely, but then the fourth one says, well, why don't you give it 3 months? Okay, now this person, if they drank again, was at serious risk for dying, but want to know what seed got planted? 3 months. And I got news for you. After 3 months of even intense treatment, that person drank again. Here's the thing about tolerance. Needing more of the substance to get the effect that you want. Tolerance, this is, 2 drinks was working for a while. Now it's not working anymore. And I need 3. Or, you know what, it's not working fast enough. Let's try a drug that's going to get right into your bloodstream. They talk about gateway drugs. You talk about different kinds of things. And, I've heard many people many times, oh, I'm never going to do that. And they wind up doing that. Oh, I'm never going to do that. I'm never going to do heroin, and they snort heroin. I'm never going to inject heroin, and they wind up learning how to use a needle. And one of the sad things about heroin is that, the tolerance on that builds up incredibly fast. And one of the most dangerous things about it is that when they stop using, even for a couple of days, the risk of overdose after a couple of days is exponentially increased, where even a slight amount of what they were taking before can lead them to an overdose. May not be fatal, could be fatal, but it's definitely a higher risk for overdose. And then withdrawal, development of withdrawal symptoms, and which can be relieved by taking more of the substance. I'm sure you've probably ever heard of the expression hair of the dog, drinking a Bloody Mary after the day after the wedding thing. And believe me, I've got my stories of that stuff. But the other part is that every substance, every mood altering substance has a classic withdrawal syndrome attached to it. People think of withdrawal with heroin addicts or alcoholics having deep, heroin addicts going through all sorts of shakes and sweats, and, and then alcoholics having DTs. I have news for you. There's withdrawal from marijuana, cocaine, nicotine. If anybody here smokes or drinks way too much coffee, try stopping. See what happens. And for those of you who indulge in a little too much chocolate, you got to be worried about that as well too. All right, so here's some of the things about the risks and causes of dependency. Now, they say that the 3 most prevalent ways of becoming an addict is genetic and having a family history of addiction. And if you have a blood relative, your chances are very high. And one of the other parts about a family history of addiction is that if there's an active addiction in the family, probably a lot of the coding skills and behaviors are being passed down as well. So once somebody starts, once a child or an adolescent is watching somebody who's having problems and they take drink, that person takes a drink and those problems go away, they're getting that mental message that, oh, if I'm having a problem, this is going to help fix it. If someone has a mental health disorder, such as depression or ADHD or PTSD, sometimes medications that are being taken to relieve those develop maladaptive coping skills to relieve the painful feelings. And the painful feelings being anxiety, depression, loneliness, and we watch the progression of these as well. And they it's very easy to become addictive to some of these medications that are taken, and then if they're not monitored properly, the pathology for addiction is increased. Peer pressure is a strong factor to use and misuse drugs, particularly for young people. I remember early in my career, I interviewed a couple of adolescents, and I said, so what do you guys think of peer pressure? And this is back in 2006, 2005. And I was immediately corrected by a couple of these people. It's like, we don't call it peer pressure anymore. We call it peer acceptance. And this sent me into a rabbit hole of doing things and finding out about how kids these days are nothing like the kids that, but we're just like the kids like I hung out with long ago in a galaxy far away. That acceptance, identity, and desire of being wanted. So many kids, they don't know how to fit in. And the other part is they don't know how to fit in their own skin either. And drugs and alcohol take them out of that pain or that predicament. All right, lack of family involvement. This also goes into the family history side about having active addiction in a family where there's difficult family situations, marital discords, moving a lot, lots of different psychosocial effects, single parent households, poverty, excessive wealth. There could be lots of things where and it's not just about an adolescent, it's about, young adults, it's about just bad choices going on, and a lack of your parents or sibling, a lack of a bond with your parents or siblings, where you don't feel comfortable and you can't communicate with them. You're like, okay, well, I just got to figure this out myself. And, this will make me get out of my feelings. And then there's early use, using drugs at an early age. We're talking, a brain does not stop developing until the age of 25. And it doesn't matter how big, how small, whether they're male or female, where they're from. The brain finishes developing between the ages of 23 and 25. Period. End of story. And when you're introducing a psychoactive substance that's rewiring your brain, remember what I said about how the central nervous system depressant, you start sending signals to the brain about coping skills, a thing called pairing happens. And what it is that, you can do something 10 times, 9 times, absolute failure. But there was that one time that it was awesome. Always default to the awesome every single time until there's a development of, to correct those maladaptive behaviors. And then, so I said there's genetic predisposition, environmental, and then the other one is actual use. There are drugs out there that you only need to do them once. If you ever want to see something, go on YouTube and look for the crystal meth ads of prevention. They're scary. Or if you want to go look up some of the things about bath salts. But the 3 most common, the most highly addictive drugs, and they rotate in the top 3, are heroin, crystal meth, and crack cocaine. Alcohol is a close 4th. And then behind that is pretty much everything else. Now, dependency is a big one. Now, what we use as clinicians, how to diagnose or assess the level of a person's dependency, we focus on 5 areas. Their patterns of alcohol or drug use, how much they use, how often they use, what was their method of induction? Is it oral? Is it inhaling? Is it smoking? Is it injection? What are the medical or physical effects as a result of their use? The either consequences, organ damage, the physical effects, getting hurt, broken bones, bruises, the behavioral or psychological effects. How does it affect their moods? What's it doing to their relationships? The family and social effects. This is where you all come in. It's like, what's going on in the house? Why, what's happening? Everything's starting to fall apart and things are getting crazy. And then there's the other effects or drug use, the progression, the hanging around with different people, the different signs that you can see of people that are active addictions, that their behaviors are changing, their friends are changing, the way they dress are changing, they're sleeping late, they're staying out late, their attitudes, it's almost like a combination of all of the above. Now, when we get into the family roles and the family systems, it's really important to understand about the family, the makeup of each person in the family. So this is very important. Now, here's a quote by a person, Joan Jackson, I'd like to share with you. Alcoholism in a family poses a situation defined by the culture as shameful, but for the handling of which there are no prescriptions which are effective or which permit direct action not in conflict with other cultural prescriptions. While in crises such as illness or death, the family members can draw on cultural definitions of appropriate behavior for procedures which will terminate the crisis. This is not the case with alcoholism. This goes back to what I was saying about not having the proper emotional responses. What they're saying here, alcoholism in a family poses a situation defined by the culture as shameful. People who have alcoholics and are the way that we have treated, there's a word for this, it's called stigma. And the biggest thing about stigma is that it goes against the grain of everything we grew up with and what we learned. Every culture has their way of how they handle situations. And, if someone dies, someone gets ill. I remember I used to work in a hospital. Now, somebody comes in a hospital, there are certain cultures where when a person's in the hospital, the entire family is in the hospital room with them because that's just the way they roll. There are others that, they're not allowed to step in a hospital, or there are, they have certain ways of believing. Look at how people deal with death, how they process grief and how they celebrate the person's life through services, depending on a religious or geographic, or country type of situation, nationality. But when there's alcoholism in the family, or addiction, I should say, those things go out the window because they're not dealt with, because the addiction always comes first. The addiction always will stump or trump the crisis. And that's what she's talking about, that this is not the case this is not an appropriate behavior. So one of the things that we do is that when we work with families affected by the disease, we have to be conscious not only of the whole family, but the individual persons involved in the family. And the family survival is based on the well-being and welfare of each individual member. So what we do is we look at each individual member and start doing an assessment on the whole person model for the 6 elements that make up the structure of the person. And these 6 capacities of each person help define and what their capacities are for development of wellness and recovery. So let's look at these 6. I'll go through them kind of quickly because we may come back to this another night. But there's the physical potential, okay? The health, the strength, the endurance of this person. All of the things that person has, the sensory, literally anything physical, that tactile, and what they're able to do. Their emotional potential, how they handle their feelings, how they process inner and outer events that are going on with them as far as their emotions are concerned, or things that affect them, like, such as family situations, natural disasters, how they handle a crisis. Their social potential, how they handle other people, how relationships are formed, where do they learn how to have a healthy, did they learn how to have a healthy relationship, I should ask, and how is it strengthened in all their relationships in their lives. Then there's the mental potential, the past, their memory and experiences, and how do they use them as learning experiences. Their present, how do they handle their situations that are in front of them? How do they prioritize? How do they manage what's their executive functioning like? And then there's their future thinking. How do they balance fantasy and imagination with goal setting and the development of new behaviors? The volitional potential, the capacity for making choices. As it's centered in the will, this is all about willpower. This is also about self-control, self-esteem, self-confidence, and how what motivates them. And then there's the spiritual potential. Where do they find their happiness, their joy, their serenity, their peace? How do they see the world outside of themselves and how they fit into it? So all of these family systems are made up of those multiple parts and how they're linked together in particular ways. So how it functions is also based on the family rules. And those rules perform 4 broad functions for the family system. And the family rules are defined by what's going on. And we're going to get into that in a few minutes. But the rules, the functions of these are to establish attitudes, expectations, values, and goals. Who is in authority? How are they going to use it? And how is the family expected to respond? Are they working as a good family unit? Okay. And when you understand and anticipate how families will deal with change within that family unit and in the relationship to the outside world. Also, to dictate how each family member communicates with one another and what they communicate about. There's that word communication again. Very vital. Okay, so let's talk about that little picture in front there. That's a mobile, and you've probably seen them hanging over babies' cribs or out in the garden, and they balance. They're perfectly balanced. And then when the wind blows, it goes, it blows around, it goes out of thing, but when the wind stops, it finds its balance again. Now, if all the attachments, as it says here, represent the family members, and the strings and the sticks represent the family rules, the analogy here is that the rules can bend, they're flexible to handle situations that come up when life gets lifey, and how the family members react and adapt to those things and eventually come back to balance. Now, the analogy is that it's ever moving, but always returning to equilibrium. Now, take a look at that blue thing there. Say that that's the addict and your loved one, okay? Now, that person is now drawing all the energy and is hanging the mobile. The mobile is unable to move. It is inflexible. It's rigid. Nobody can adapt or find that equilibrium and that harmony that the family desires that are needed so much. So this is where communication stops. And communication in a healthy family encourages a back and forth to be able to discuss feelings and not have secrets. An unhealthy family has rules that limit communication and has more secrets. So when that mobile is out of there and those family rules and the rigidity, the thing that's going first is probably communication. And Calvin and Susie there are great little examples of that stuff. All right, the alcoholic family has a lot of defenses: denying, blaming, shaming, high intensities of anger, fear, shame, guilt, always leading to hostility and resentments. And those lead to anxiety and tension, more shame and guilt. And then the feelings of worthlessness and remorse become prevalent, not only in just the addict or the alcoholic, but in other members of the family as well. And when I get into the family roles, you'll see how that can start coming through. And the 3 rules: don't talk, don't trust, and don't feel. And those are prevalent. All right, let's talk about the roles of the family roles. And we're trying to rock and roll through this here too, so I'm not taking up all of your time. Now, the dependent, the central focus of the family, the one who's pulling the mobile out of the picture, the one who's controlling everything and who's usually out of control. The enabler, the primary person in the relationship with the dependent, holding the family together, denying things are going wrong, certainly not taking care of themselves, protecting, keeping secrets. This time is going to be different. Don't worry, things will get better. And in different family systems, they can also be parents, roommates, lovers, oldest child, or another family member. The hero is usually the oldest son or daughter, most helpful inside the family, and usually an overachiever and successful in order to deal with the hurt and fear of abandonment. And here's a really good question. What if this child is 9 or 10 years old and has now fallen into the role of hero child and having to become the parent or parenting? The scapegoat is most often a second child, never achieves the same status as hero, withdrawal from the family, and the scapegoat usually becomes attracted to others, finding things outside the family to enhance their self-esteem, and most likely becoming the next addict or alcoholic in the family. The lost child is a middle child, third or more, and simply withdraws, deals with hurt by avoiding it, becomes emotionally or socially withdrawn, removes themselves from the family system, can also fall into paths of addiction as well, but usually winds up having more emotional traumas. And then there's the youngest, the mascot, vies for attention by seeking attention that is distracting and mostly lighthearted, being the clown. Let's tell a joke, hey, look what I'm doing. Look what I'm doing. Watch me. And these roles rotate. And sometimes if there's just a couple of kids in the family, or there's, they can move. If the hero moves out, somebody comes, the mascot sometimes becomes the hero because either the scapegoat or the lost child. It's a very dynamic situation. Now, ACOA, Adult Children of Alcoholics and Codependency. Codependency is going to be a topic we're going to do in another group, but I want to go through this right now to give an overview because it's really important as it fits in with all of this. The 6 primary characteristics of codependency are: have an excessive and unhealthy tendency to rescue and take responsibility for other people, derive a sense of person and boost self-esteem through extreme self-sacrifice to satisfy the needs of others, choose to enter and stay in lengthy, high-cost caretaking and rescuing relationships despite the costs, regularly tries to engineer the change of troubled, addicted, or under-functioning people whose problems are far bigger than their abilities to fix them, and seem to attract low-functioning people looking for someone to take care of them. So this is the other side of it, so that they can avoid adult responsibility or consequences. So this is the other side of the coin. And, attracting people in perpetual crisis, unwilling to change their lives. And having a pattern of engaging in well-intentioned, but ultimately unproductive, unhealthy helping behaviors, such as enabling. All right, so I want to wrap this session up with a couple of things here about what we do when we talk to family members. And we're going to get into more of this stuff later on. But like I said, I want to touch on these things now, let you know how we're going to get to this stuff. I like people to see what the ending is like, so that we know what's at the other side of this. So when we ask family to make commitment to take care of yourself by getting professional treatment, we're joining a self-help 12-step family program and getting mutual aid support, other people who know how you feel. Al-Anon, Nar-Anon, all of the Anons, the family group things, but there's also Families Anonymous. If you belong to a church, there are probably groups in there to help you. There's things out in the community. You'd be very surprised, but there's also therapeutic groups as well that one can participate in. Don't deny, minimize, or cover up for the problem, and acknowledge what it has, and acknowledge what it has done to you and your loved one. Say, okay, look, I've had enough. This is what it's doing to me. You're getting honest with yourself on this. And learn about recovery programs and resources in your areas for chemically dependent persons. Go to an open AA meeting or NA meeting where people are out there telling their stories so that you can kind of hear what it's like for them. But one of the other things that I like to say, it's a lot more than going there and listening to a person's story. Go a few minutes early and stay a few minutes late. Watch how they all interact with each other. Look at what's going on, how they treat people they recognize as new in the program. How some of the people, I also tell my clients, I say, none of these 12-step programs are fully bastions of mental health either. You're going to see some people in there that, like, okay, but you know what? We're all here. Nobody's ever going to rise above the level of being human, but predominantly you're going to see a completely different attitude of unconditional love and support. You have to understand recovery is hard because it's change. Learning how to break the patterns of what you've been doing for so long are really hard, especially when you start meeting resistance. So learning how to be patient and supportive is very challenging. Most of that patience needs to come from your own self of you realize how the signs and symptoms, and we're going to get into that next week, of how similar the feelings and symptoms are that family members have that the addict and alcoholic has, and nobody's taking a drug or a drink. Lower your expectations. There are no shortcuts or easy solutions, but recovery is possible. Don't give up hope. Recovery is possible. It all is based on willingness. And if someone's got willingness, it's amazing. It's amazing what you find for yourself. As I said, it's not your fault. You didn't cause it, you can't control it, and you can't cure it. And acceptance is a very challenging part of this as when we go into recovery mode. So, as I said, you can't control it. You can't find their bottom for them. That's an intervention. That's why interventions are very challenging, because when you find somebody's bottom for them, they're not finding it for themselves. They're not doing it for the full, they're not all in. And if they're not all in, they'll find an out. And when they find that out, they'll blame it on you. So their recovery is their journey, just as your recovery is your journey. And how you have to you have to decide for yourself, when do I get off the elevator? And just a little reminder here, you can kick the elephant out of the living room. And I want to say thank you for being a participant of this meeting tonight, and of this presentation. And what I'm going to do